So, good evening, everyone.
I'm just
I'm glad that all of us have joined here. I'm so glad that we are here, all of us. So, this particular session of ours, the panel discussion, is a very important discussion. We're going to be talking in depth around a lot of subjects, and we have a huge, very heavyweight panel with us. Let me begin with a simple question. When was the last time you listened to your body before it actually forced you to? Because that is where most of us are today. We don't respond to signals, we respond to breakdowns. I think somebody's, yeah. As I was saying, because we don't respond to signals, we respond to breakdowns. A headache becomes a pill, fatigue becomes it's just stress. Hormonal changes become something to endure quietly. And somewhere in this pattern, we have normalized suffering and outsourced responsibility. Today, we are more informed than we were ever before. We have reels, we have podcasts, we have articles, experts everywhere. And yet, the confusion has never been higher. We fear medicines. I'm really heartbroken at this. We fear medicines, but we abuse quick fixes. This is something painful. We avoid hormones, but we ignore lifestyle. We chase symptoms, but we neglect the system. So today is not just a panel discussion, it's a pause to ask, are we truly taking care of our health, or are we simply managing our problems from day to day on a better level? At the Global Menopause Collective, our work is rooted in one belief, that the true health begins long before disease appears. Today, we bring together voices from modern medicine, we bring voices from oncology, Ayurveda, lifestyle, science, and policy, not to compete, but to complete the picture. And something tonight that we're going to be talking about is going to complete that assessment, that understanding of yours. Because health is not one system, it is a conversation between many systems. And today we begin that conversation. Today's panel brings together not just experts, but perspectives. We have doctors who work with the body, practitioners who work on the mind, and voices who understand the system behind healthcare itself. Each one of them sees a different layer of the same truth, and today we bring those layers together. I'm really proud to introduce my panel. I have Dr. Hitesha Bhatt with me. Dr. Hitesha brings in more than 30 years of experience. She's an MD, she's an OB/GYN who works in the area of menopause counseling and therapy. She's also a yoga and meditation therapist and a mindfulness and hypnotherapy consultant. She has conducted multiple awareness and counseling group sessions focused on holistic healing in menopause. She holds a postgraduate diploma in clinical hypnotherapy and is the author of Menopause Decoded. It's a beautiful book. This book presents a holistic approach to understanding and navigating menopause. So thank you so much, Dr. Hitesha, for agreeing to join us here. Next, I have Dr. Sulbha Arya. Dr. Sulbha Arya is an oncologist and midlife hormonal health specialist. She is a founder of Redefine Midlife. She's got over more than 20 years of experience in women's cancers, and she now works closely with women aged 35 plus navigating perimenopause and menopause. She supports them in managing weight changes, fatigue, and hormonal imbalances through a structured, science backed lifestyle approach. And she has helped over 1,000 women regain clarity, confidence, and relief from their symptoms. Next, I have somebody very special, Lotika Kajuria ji. There are some voices that speak from knowledge, and then there are some voices that speak from experience earned over decades, which quietly shape the systems we often take for granted. It is my privilege to introduce someone who brings that rare depth of perspective. Lotika ji has been a former drug controller with the Government of India. She has had a glorious, remarkable career of more than 29 years to the regulatory framework that governs the safety and quality of medicines in our country. Dr. Purvi Patel, I welcome you. Dr. Purvi Patel is a menopause specialist. She's a homeopathic consultant, life coach, and mindfulness expert. She works as a holistic health practitioner, supporting women over 35 in managing hormonal changes, weight, and emotional well being. She is a founder of Empowering Divas Hub and a trustee at Rutuja Charitable Trust in Surat. She is also the author of ebook No Pause at Menopause. I would want her to share that link with us. Next, I have somebody who joins us from New Delhi right now, Dr. Shrestha Gupta. She is an accomplished obstetrician, gynecologist with more than 12 years of clinical experience in women's health. She holds an MBBS and MS in obstetrics and gynecology, along with a fellowship in colonoscopy and cervical pathology from ISCCP. And she has further specialized training in medical genetics from ICMR Mumbai. She is currently serving as assistant professor in Maulana Azad Medical College. She's also been working at Safdarjung Hospital, Delhi. And today, she's also the wellness director at Live Gracious and the women wellness partner at Becoming Gracious. Someone very special to our collective next, Dr. Chetna Kotwal. Dr. Chetna Kotwal is a BAMS qualified Ayurveda practitioner, and she would be presenting a beautiful perspective today. She has an MSc in yoga and over 6 years of clinical experience. She also works as a consultant specializing in Nadi Pariksha and Marma therapy, bringing a holistic and integrative approach to the health and healing. She is the founder of the Healing Groove. That's a corporate wellness venture that takes Ayurveda based healing practices to organizations across the world. So, thank you, all of you, to have agreed to join us and to bring your own perspectives to this particular collective. I would start with Dr. Shrestha Gupta. Dr. Shrestha, we often see a growing hesitation around medicines today. From a clinical standpoint, where is this fear coming from, and how much of it is valid, in your opinion?
Yeah, so the fear around medicine, it is deep rooted and it also is familiar, as in, it is coming across generations, telling that if we are taking medicines, then we are interfering with the natural process in our body, right? So, and also people, they have a family history of telling, then they have this fear of cancer, especially when it comes to, menopausal therapy. So, and yeah, so this fear around medicine, it's not, a short-term thing. It has been there for quite a while. and it's still there. And people, they don't know like how, medicine they benefit, and it's not something which like in which you are interfering with body or you are disrupting the natural process. They fail to understand that it's just adding to the natural processes which are happening in your body.
So, do you think, in your opinion, how should a patient differentiate between necessary intervention and over medication?
So,
Do you see any defining lines in this?
so the defining lines are not very clear, they are blurred, but more often than not, over medication is still a rarity because in a country like ours, where nutritional deficiencies are so rampant, mostly, mostly women are deficient in their diet, and so more often we see more of nutritional deficiencies only. So, over medication thing is a rarity, and this is something which people they fail to realize. And of course, many times uh, we have blood markers which tells whether over medication is a problem or not, whether a medicine is being overloaded in the system or not. So we do have blood tests, and doctors they often prescribe those blood tests to have a check on the overuse of that medicine.
I would like to bring in Dr. Sulbha Arya about this. Dr. Arya, what's your perspective of what has been posed to Dr. Shrestha Gupta? What's your perspective to it?
Yeah, so I believe that medication isn't essential, but before medication, the awareness about the benefits versus the side effects is important. And I feel there is a lot of over medication going on here, particularly in India, because they are very easily available. We can just go to any chemist shop without any prescription, also, you can buy
Over
supplementation.
the counter. Over
Yeah,
the
over the
counter.
counter you can buy them. Then there is a lot of, crisp information or misinformation that is available over the internet, over chat GPT and all of these places, Instagram. They will tell you, oh, protein deficiency, you must take these things. Oh, you're not able to sleep, take these things. And people are self-medicating themselves based on
So
that.
basically, what you are trying to say is that people believe Dr. WhatsApp, Dr. Instagram, and Dr. Chat GPT more than a real human doctor. That's what exactly is
Yes,
happening, right?
because yeah, there are again two things involved in that. People are more afraid because they feel if they'll go to a doctor, then they'll get a list of tests that they'll have to go through, and that'll first the doctor fees and then the test. उससे अच्छा तो we'll take the supplements and
Yeah, be better. Be
हाँ भी
better. हाँ
yeah.
मतलब है ही क्या इसके अंदर सिटी तो
Unless
दुख रहा है डजेंट
even
मैटर आई मीन एक
until
डिस्प्रिन खा
unless you
लो.
are on the bed, you don't feel the need to go to a
Yes,
doctor.
of course, that's another point. So basically, for you to be convinced enough to go to a doctor, you have to really, really feel sick.
Sick.
And then also, you want to go to a doctor who's going to give you a quick fix.
Quick
Take one
fix.
pill, take one shot, and there you are. You don't really
Yeah.
have to treat the root cause.
Yes, yes, yes.
Does this again overlap or over lay with HRT? Do you think?
So, in so far as HRT is concerned, right now I'm not seeing that there is any over medication or anything because right now it's a fear-based area.
So the inhibition part is there,
Inhibition part is there. So
right?
people are very, very scared. But definitely 5 years down the line, I do visualize this thing that when once the HRTs are available over the counter, people will start using them very freely. There'll be more studies also available. Right now, everybody has the mindset that HRT can trigger cancers, and cancer is a very big word for them. So yes, there is a little apprehension around HRTs, and there is a fear-based psychology which stops women from, even though they, in some cases, it can be really effective. But yes, right now, one availability issue and second misconceptions around HRT is
But
stopping.
do you think, Dr. Arya, do you think? I mean, you see, you've been working with perimenopausal women, menopausal women, so many years. Do you think that HRT, something which is going to be interfering with your hormones, which is going to be interfering with your internal chemistry, not only as a patch but as something which stays inside you, should that be available OTC? Should that be?
See, in my 10 years of practice, I have usually tried to integrate the lifestyle practices. It was only last year that the black box label was removed and the
Right,
HRTs have become like a free use. So there
right.
is a lot of information that we are also processing as doctors, how safe it is, and the availability is also limited. Plus, the people are also very, very apprehensive in trying, even though we suggest. But having said that, the studies definitely show a lot of improvement in symptoms. Now, when I talk about symptoms, now the HRTs are not only for the period issues. They help women with so many things that they are suffering. It could be your, bone health. It could be your temperature regulation of the body, like hot flushes, night sweats, which a lot of females are suffering from, and they actually affect the quality of life, the mood swings, the sleep issues, the libido, the everyday quality of life. When it is too much for a woman to bear, then I do think that HRTs is not a bad option. And in fact, I was having a conversation with a client from abroad. She's not really my client, but we were just discussing around this. They, in Australia, they have freely started using
Yes.
HRTs as soon as the woman reaches her menopausal years. By when I say that, it could be not that she has attained menopause, 2 to 3 years before menopause, they start using it and they go up till 5 to 7 years of using that, and they have seen significant benefit.
So basically, what you're trying to establish here is that although there is enough science that backs HRT, but then again, there is a problem with the narrative that has been set around HRT. You know,
Yes, for me also, I feel that HRTs does not come as the first choice.
it should not.
Yeah, it's not the first choice, but I don't disregard it completely. I feel that if the symptoms are too overwhelming, see, if there is no one size fits all, but if the symptoms are too overwhelming for a patient who has not been able to manage them with the lifestyle changes, they should consider. They should definitely make an informed decision after getting to know all the pros and cons.
I would take this point. I would take this point to Lotika ji. I would take this point to Lotika ji, and I would ask her what are the various strengths regarding medicines? What are the strengths that should be considered? How does the regulatory part in medicines work, Lotika ji?
Yes. I thank you very much. I agree with Dr. Arya because HRT treatment is really required for many ladies who are having so many symptoms with regard to bone and this thing, hot flashings and everything. With regulatory point of view, whatever the medicines you see in the market, they are all FDA approved. The strengths are approved by the food CDSCO, Central Drug Authority, and
Right.
after the approval, medicine and strength, and they are generally low dose clipping this birth control pills. They contain low level, low doses of estrogen and progesterone. So all the strengths which are available in the market are approved by the CDSCO and then by the state authority, and then they come for the manufacturing. So there is a lot of regulatory control over the doses, strength, and everything. And whatever is available in the market is first clinical trials are done, and then after that only these medicines they come into the market. So regarding that black box which was there last year, it was removed just because the clinical trials were going on and research oriented work was going on, and then they decided that they must have tried on many patients, and they saw that there is no nothing of that I mean, ill effects on the patient with regard to cancer, breast cancer, and all these things, and these were removed from the boxes. Other than that, although there are contraindications too and side effects too, but it's a very, safe drug to be used for HRT. I just want to put my stress on the other part, that is bioidentical hormonal replacement therapy, that is plant derived hormones. They are clinically identical to those that are produced in the human body, and these compounds, when they are used, their strength, their dosages, they are not properly fixed and they are not randomly checked for their quality assurance. So my main focus is on these bioidentical products that are being approved by the Food Safety Authority of India, but still making combination with other drugs, like if you add everything in one drug like calcium and all that, all this plant based, plant derived, but where is the research and where is the quality, whether it is organic or not? And secondly, the strength, whether that quantity contains therapeutic
Enough.
dose which is required for the patient. So that is the prophylactic dose, no? Because whatever is we are getting is the preventive dose. And
So Lotika
these,
ji, यहाँ पे just kind of simplify the thing, explain it a little more to us. What are the two columns that you're talking about? Therapeutic versus nutraceutical. What are these two columns? Just explain a little more
nutraceutical,
simply.
uh, this plant-based products which are available in the market, which we can, which we say that these are the food supplements, they are generally basic requirement of the body. This what you call this as a uh, daily requirement of the body. So
Right.
that is thing, it's not a therapeutic, like whenever you are treating some person, some doctor is treating some person, so they require some kind of dose so that the action is, I mean, there is some blood or there is something, absorption, ADME, everything, they must be knowing everything, but this thing is not there. That dose is less than the therapeutic dose, and it is only a preventive dose, the basic dose that is required for the body every day, daily need. So you cannot, it's a kind of supplement. It is not a drug. It's nutraceutical, it's not a pharmaceutical. So there is a difference between these two names.
All right.
So
All right.
that's why some people, they don't go for these medication, HRT or whatever doctors they prescribe. They go for other than that, over the counter, like madam said that they take the medicines. They are generally food supplements or nutraceuticals. For as far as HRT is concerned, it's not over the counter drug, because it is being misused by the young girls for many purposes, because they are duped by I mean, not by the doctors but by the pharmacists or by some other people. It's a kind of the hackers, they do all these things. That's why it is placed under prescription, so that it is not being misused by any of the person. So
And
I don't
moreover,
think
it's
there is,
got serious implications if it is misused.
yes, if it is done, then you will get, and you will land into hospitals. So
Hospital, yes, of
I
course.
don't think there should be any, it shouldn't be available OTC, because I have seen many cases in Kashmir, because it's a very closed system, closed society. So they don't discuss these problems at home, and they were using these drugs over the counter, and there was lot of problem. Many people got many other than this
Obviously.
abortifacient, you see, they are taking over they used to take over the counter, and many things happened, and many young girls died because of this. So this was made mandatory that it should be prescription drug, because we have so many consultants in India. We don't lack in India, at least. So at least it should be prescribed by some doctor, so that whenever some problem comes, it can be monitored by the doctor.
So is
And
it
if
is
there,
it is it regulated? Is there a specific regulatory authority which monitors the execution and implementation of HRT? Is there a
Yes,
specific?
there is no regulation means there. You see, whenever you get the product approval, any drug product, so the right from the beginning only, you are getting the approval for this that strength, that dosage, and everything is being designed that way. After that is the product is manufactured by the manufacturing company. It comes into the market and it is being prescribed by the doctor. So there is a stringent control over this process.
So
When there is some
which doctor, Lotikaji, which doctor, what should be the minimum qualification of the doctor to kind of prescribe MBBS is good enough, right? You don't
and
need to
also
be a specific endocrinologist or a gynecologist.
endocrinologists, they are, I mean, they are specialized doctor, but basic qualification MBBS is more than sufficient because I think they know a lot of things by 5 years. That is not,
Okay.
but it should be a prescription drug. It's a
So what
prescription, it is prescribed by the doctor.
what we are
Second,
trying to dissect. Sorry.
uh, uh, second part, I want to discuss that this HRT drugs, whatever are available, they are manufactured by very big houses, and there is a price control on these drugs
Right.
because it comes under the ambit of National Pharmaceutical Pricing Authority, and they have sealed the price of these drugs because these drugs, they are essential medicines that are required for many of the patients in India. So uh, then there is a price control. They are means they are cheaply available rather than these nutraceuticals. They are exorbitantly priced whenever we go to the market and buy them, saying that they are herbal products, they are, I mean these nutraceuticals. But I think one should follow their doctor's advice rather than consulting themselves.
Matlab self medication, don't get involved in self medication.
This also because uh, I think this is the problem. It is to be discussed with the
With the
prescribing doctor
concerned
whenever
doctor. I mean,
any
yes.
reaction. If some medicine reports some drug in pharmaceutical, I am saying not in nutraceuticals. If there is any adverse drug reaction reported in these formulations,
Right.
then you can report it to pharmacovigilance group 2. There is now
Okay.
it has been made mandatory in every chemist and shop. There is one QR code is there. There is online. I mean helpline number is there. Just you have to scan that QR code and then you will say that this drug has adversely affected me. So that will go to the Pharmacopoeial Commission of India and they will see what was the reason. So
What was the
it's all
problem? Yeah.
regulated.
It's
Yeah.
all
So
regulated.
we should take the medicine which is being regulated in India and otherwise also in other country parts, rather than going for the products that are readily available.
Right. So basically,
Patient
what I will try and sum up what you just said. Number one, there are two strengths. One is a therapeutic strength and one is a nutraceutical strength. Nutraceutical strength of the salt or the medicine or the formulation is the strength which is supposed to be a preventive dose, not a
yes,
curing dose, right? Once you land at a certain severity of a symptom and you need medical attention, you need to go in for the therapeutic dose of that particular medicine. Number one. Number two, therapeutic doses can only be prescribed by a prescribing doctor who is certified doctor, and nutraceutical can be taken off the counter. Nutraceutical uh, nutraceutical products do not fall under the ambit of pharmacovigilance. Am I correct in my understanding?
no, they fall under the ambit. We just I read that even you can complain for nutraceuticals too in
Right.
pharmacovigilance of India, but still some of the products, if they are being regulated by the food safety authority, then there is a regulated channel. But other than that, if they are coming into the market through some other source, like very influential products are there, they are
Yeah.
coming up. We don't have any data or their, I mean, kind of tracking system then it becomes difficult.
It becomes a problem. It becomes a problem. I want to move on to. That's a wonderful perspective you presented, Lutika ji. But I want to move to a bigger thing, more human sort of a perspective. I want to bring in Dr. Hitesha Bhatt here. Dr. Hitesha,
Yeah.
how do you think all this starts? The fear of medicines, the fear of going to a proper doctor, and probably just kind of staying indoors, checking on Instagram and WhatsApp and taking advice from our own peers and getting involved in self medication, as Lotika ji just said. How do you think, how much is the fear actually psychological? Does this, is there a psychology which actually prompts you to do all this?
Uh, yeah, the fear, I think I keep telling my patients that, when they come with a small child, if that child is crying or creating some mischief, the mother will say, Ki, doctor will give you an injection. Right? So sit properly, sit quietly, otherwise the doctor is going to give you an injection. So this is very common. I'm sure all the practitioners must
Yes,
have
yes,
listened, come across this. So I always tell them that, see, you are imbibing the fear of a doctor in that child,
yes.
right? When he's a toddler. Don't do that. So one thing is this, that the fear of going to a doctor is always there. For us gynecs, it is, see, most of our things are physiology, right? See, menstruation, pregnancy, menopause, they are all physiological things. And when they come to us, and if we diagnose something, they have that fear ki if we go to a gynec, they are going to give you some diagnosis, then they'll go for a hysterectomy, they'll go for a DNC, they'll go for this, they'll go for that. So that fear in women is always there. Then, as I said, it's a physiological thing. There'll be so many inputs from the family, from the surroundings, that this is very common. If you are having heavy bleeding, it's okay. This is menopause. It will stop. You are having this, it is going to stop. You are having that, it's going to go away. Even we had, and everything is normal. So all these things, they help in building up the fear. And as Dr. Sulabha said, that there is very less compliance, and people, the over the counter thing, that is also very rampant. They don't know uh, which doctor to go for what
Absolutely,
symptoms.
absolutely. Yeah.
And that is why, see, suppose if I have a backache and my cousin has a backache, my cousin will give me advice that
Yeah.
do this, you don't go to a doctor, otherwise they'll prescribe you an MRI.
नो नीड
So
टू गो टू अ डॉक्टर. हाँ ठीक है, ये हो जाएगा. मेरा भी ऐसे हुआ था. वॉलिन ही लगा लो, हो जाएगा. दैट्स इट.
exactly. So all these things, they help in building up the fear, and because of this fear, the compliance is very low. So when Lotika ji was telling that anybody can prescribe, I beg to differ, because that has happened with our MTP pills. Like, we get abortion pills. It was supposed to be given by a gynecologist only, and still we give ourselves, when a patient comes to us, we do an ultrasound and give the medical abortion tablets. But then now all the general practitioners give it, and it is readily available in medical stores. So there is no regulatory authority which says that these are supposed to be prescribed by a gynecologist only. So these things, then when there are side effects, when there are no effects of the drug, it again builds up that the drugs are not acting. On the contrary, I'll take advice from any Tom, Dick,
Yeah.
and Harry who is
Yeah.
going to help me. So this is, I think, how the psychology of
The usual Indian context is that हाँ चाची जी को भी हुआ था, उन्होंने ये लिया था, तो हम भी ये ले
yeah,
लेते हैं, and now it will be okay, है ना? And चाची जी probably has not told you कि क्या क्या side effects हुए थे, you know?
exactly.
And this is
Yeah,
exactly what happens. I mean, this we see everywhere, starting from children. That
yeah,
yes, my son's classmate had a viral, तो उसने ये लिया था, हम लोग भी ये ले लेते हैं. साथ में आप बीच में ही देसी नुस्खे भी आ जाते हैं कि गर्म पानी के अंदर आप ये वाली जो है फिटकरी डाल के और हल्दी डाल के आप ये गरारे कर लो. Everything is going. So we don't stick to one particular thing, right? If 2 days an allopathic medicine has not worked, we will straight away jump to homeopathy. नहीं ये काम नहीं कर रहा है, इसके साथ होम्योपैथी भी ले लो.
Yeah.
अब ये वाला भी नहीं काम कर रहा है, चलो आयुर्वेदा के पास चलो. अब ये नहीं काम कर रहा है तो चलो वो नानी से पूछो कि वो क्या करती थी. And poor child, that fellow is, laden with everything, right from haldi to fitkari to antibiotics as well.
And we say that Ayurveda is safe, but I'm sure they are going to agree, the Ayurveda practitioners, that it also comes with the dosage. You can't
Yes.
take it blindly. I've seen one of my family member who was having jaundice, and some person, I'm sure it was a quack Ayurvedic practitioner who prescribed some bhasma, and it had lot of iron in it, and that boy went into iron toxicity. He had a liver failure, and it was
God.
very difficult to bring him back. So yeah, it was only a simple concoction jo boil karke it was supposed to be taken. So I would say that none of the medications should be taken unsupervised, and each medication has its own practitioner. They are to be they are
You
to be
have to.
taken
You have to.
at
This
certain
has to be in guidance. Unless and until you know your body so much that you can very well take care of it by yourself, rely on somebody who really knows what he or she is doing.
yeah.
And so what we are seeing here is what we are seeing in this whole thing is that the problem is not medicine. The problem is our relationship with medicine. If medicines are what we turn to when things go wrong, then prevention is what ensures things don't go wrong in the first place. And so, prevention remains the most ignored aspect of our health. For covering up on this, I want to bring in Dr. Purvi. Dr. Purvi, she has been practicing lifestyle and holistic medicine for so many years now. I want to ask you one thing. Why do people struggle to stay consistent with preventive practices? They learn very rightly, they are very enthusiastic when they want to learn some preventive exercises and preventive practices and grounding and even for that matter various things, yoga, but they do not, or they are unable to stay consistent with that. Is it something to do with the Western culture that yes, you've got a pill for everything, no need for all this drama, just take that pill, everything's going to be okay, do whatever you want, just take, at the end of the day, take a pill, drink heavily in weddings, and then after that you have a IV catered to by the wedding hosts? What do you think is happening, Dr. Purvi?
Yeah.
Yeah, please go ahead. You need to unmute yourself.
Can you help me?
Yeah, okay, please go ahead.
Yeah, yeah. So, yeah, my first day is quick fixing. Everyone wants that their problem should go away in a one night, no matter what they are suffering from or what they want, because they want that their life should go as normal as they are living at 20s or in 30s,
Right.
because in India, especially in India, uh, women never taught that there are three most important stages of their life. The first is puberty. I would say three P's. That is puberty. No woman gets education like when they were in a pubertal age. There is very less education on menstruation also. So it is still taboo in India to talk about menstruation. So puberty, when they have their first pregnancy, and third is perimenopause. So there is no education in India around this perimenopause kind of thing. And when people fail to get result from some medications, maybe this self medication or prescribed by doctor, they would come to us like telling us that what we'll do. So as I give them holistic practices, they'll do for some time, but they can't make it as a lifestyle changes. Like I tell them every woman should start intermittent fasting after the age of 40, because our body needs less food and more activity. That is my mantra I give them. After the age of 40, our body needs less food, more activity. They do, they start, but that old habits, that subconscious habits, they come in. And that's why they need proper guidance, at least minimum for 6 months. So that the system, whole system gets changed. But they don't have that much patience. They will come, they will try, they will get result in a month, and then they discontinue.
So is this a
No
knowledge
matter
gap, or
it
is this
is
a
about,
behavioral gap? I mean, there's a problem with the knowledge, or there's a problem with the behavior and the thinking pattern.
it's a behavioral and thinking pattern,
It's
because
nothing to do
as
with
Dr.
knowledge.
Hitesha,
Yeah, yeah. Please.
see, knowledge they don't get only from us. Knowledge they don't get only from us. As someone told that they have internet, they have AI, they have so many things. From that they get knowledge. If I suggest something, they'll go
I'll
and check with their
I'll
friends.
I'll interject here. And everybody will agree with me. It's not they, it's we. Now when I have to learn about AI, I will go to all the possible things, right? I will go to all possible ways. And while searching for those particular things, I'll come across somebody who's, giving me a reel of what he was doing at 40 and what he's doing at 45 and how he's chiseled and everything. And I'll get swayed into it. And then I start following that thing. And then I start dreaming about that. So all that gyan that I was carrying just 5 minutes back has switched, has swayed. So over
Yes.
informed and less believing is the correct word right now, right? Yeah, please go ahead.
Yeah. So they, as you say rightly, that they go somewhere and they again ask to some more people, because everyone want fixed changes. If I suggested them do this and do some lifestyle changes in diet or do start yoga or exercise, they will do, they get result, and again they will stop, because someone else came and tell them that, oh, I have some quick fix it. So there is so much of indecisiveness, which is also a part of menopause symptoms. So much of anxiety, so much of stress, so much of you can say over knowledge. What you told,
Yeah.
that don't allow them to stay consistent on their path,
I'll tell
because
you
they are
something
fed up
very. I'll tell you.
from.
I'll tell you something very funny. The other day, me and my family, we were going for a drive at night. And usually, whenever we go for a drive, we stop over at some ice cream wala and we pick up ice cream. So my son, and this was late February. So my son says, Papa, aaj ice cream khani hai. Suddenly, my daughter, who's 12 years, she wasn't even 12 at that time. She says, तेरे को पता नहीं है, ज़्यादा शुगर खाने से डायबिटीज़ हो जाएगा, प्री डायबिटिक हो जाएगा. I said, he is 6 यार, खाने दो उसको, प्री डायबिटिक कौन सा हो जाएगा वो. And children have started talking about GLP-1. Frankly, I swear I don't know about GLP-1. What does GLP-1 mean? I can't explain to you what is GLP-1. But children have started speaking this language. So there is enough information and they are correcting themselves. When I say they, I'm talking about these kids. Forget about the adults. So you've got Dr. WhatsApp, Dr. ChatGPT, Dr. YouTube, Dr. TikTok,
Yeah.
Dr. Instagram. Those are the bigger doctors.
Yes.
Yeah. who get millions and millions of
Yeah.
consultations every day. Dr. Sulbha, Dr. Sulbha, in your practice for all these years that wonderful years that you've practiced, how has this shaped in your work with women of 35 plus? How early do symptoms actually begin before they are acknowledged by your patients?
So, usually, I see that if there is no other cause, if everything is working fine, after the age of 35, slowly and steadily, females they start showing a decline. Some or the other symptoms starts appearing. It's a very subtle change, and it all doesn't come all at once. It's like it'll start with sleep issues, maybe, and we'll keep ignoring it. It may start with anxiety issues, emotional thinning, you become overreactive at home. अब कहीं आप एक बारी दो बारी चिल्ला रहे हो तो किसी को नहीं लगता ना कि मुझ में hormonal changes हैं.
Yeah.
So like that, small things, low libido, and then the bone and the muscle strength doesn't even become visible until the
Till a long period of
till
time. Yes.
late 50s or 60s.
Yeah.
So we keep on ignoring, but the shift starts happening after the age of 35, most commonly that I've seen in form of whispers. But yes, in my very recent conversations, in very specialized cases, I'm also seeing the shift after 30. And these women are predisposed to very early menopause in their early 40s.
So what do you think is the cause for this predisposition which wasn't there, let's say, 20 years back? What has changed in these 20 years?
No, I will not say it was, it may have been there, maybe the incidence was less, but
Maybe the
because
reported cases were less.
yes, the reporting was less. People never, females never talked about menopause. They never, discussed this. हो गए बंद हो गए ठीक है doesn't matter, life goes on. But nowadays females have become cognizant. They do discuss, they do try to find out what's happening to their
What's
bodies,
happening? Yes.
yeah, what is happening to their bodies. But I'm not really sure of what could be the reason, but I think it's very individual. In some cases, I've seen genetic predisposition also. Usually, the patients would be telling you that their mother, when they talk to their mothers or their aunts, they found out that they had an early menopause.
So what we are trying to look at here is, through your talk, is that we've started to normalize a compromised life, a lifestyle, compromised lifestyle. Energy wise, you're going down, you start to normalize it. Libido is going down, you start to normalize it. Relationships are decaying, I'm sorry to say. We start to normalize this.
So, this is all because we've been taught to live like that. I mean, when I was growing up, I have been in an urban city, I have been the best of the schools, but I never saw my mom talking about it. My mother herself is from a convent school though, but women never, they were not brought up in a way that where they would become cognizant of their issues and they would talk about it. Self-sacrificing and nurturing mode में they were.
मार्टियर मोड में ही होते हैं ना.
Yeah. And one thing was that, and another issue I feel even going on in female minds today is that they don't want to acknowledge the fact that they are arriving at menopause or the changes are happening because it is it's kind of they associated with aging, and they don't आजकल तो और ज़्यादा they don't want to accept that they are moving towards that side of life.
Yeah, absolutely. Now this brings a beautiful perspective. Again, I would want to pose this to Dr. Shrestha. Dr. Shrestha,
Yes.
if I may ask you this particular question. From a clinical perspective, what are the early warning signs that you have seen women ignore the most and somehow, come to a point where it becomes unbearable? Things start to fall apart all around them. What's happening?
Yeah, so when we speak of menopause, we see it as some sort of a destination to arrive. But what people fail to realize that there's a transition phase. These symptoms don't happen all of a sudden. And these women, they come up with symptoms like brain fog, and they have these problems of irregular periods, which are very subtle in nature, right? So, and then they have cardiovascular issues, which are not very apparent. We are just only looking in the lab results. And so there are many symptoms, and interestingly, these aren't the primary complaints with which the women, they come to our clinic. They have whole other problems, and when we
Like
probe
what?
them,
Like what? What do they come up straight away with? What are the superficial things that they come up with?
so they only know that their period should be normal. That if they are in excess, oh yes, and if they are getting, very anemic, and if their blood reports show hemoglobin of 6 or 7, they will not come to us unless, hemoglobin drops to 6 or 7, right? What they don't realize that the symptoms, they affect the entire body, right? They may be experiencing hair thinning, hair loss, and they may be having subtle changes in their skin in the form of acne, and then drying of the skin, and then parchy skin, and they may be having genitourinary complaints. We are so dismissive about UTIs. Women have recurrent UTIs and they just ignore it. They just say, हाँ इतना तो होता रहता है. Like this is normal. Burning micturition and urgency of micturition, they have become such a part and parcel of a woman's life, and they have accepted that thing that recurrent UTI is not something I should be visiting a doctor, and I'll take just I'll take more water, and I hydrate myself. So those are things. And then there are muscle aches, joint pains and stiffness. We are like so dismissive of those symptoms,
You know
and we just
what has
attribute
been
it. Yeah.
what has been happening is that the moment you start to have hair thinning, you immediately go to Instagram and you see a few ads, right? Instant ads. And there will be a spray, there will be an oil
Yeah.
that, okay, you will have volume. So they've named their companies with the word volume there, right? So then again they show you this, that I was this, and in 10 days my volume increases. So that's your quick fix is done. When you
Yeah.
start to have acne, I remember a couple of years back, I was sent a reel that kindly comment on this. And that reel there was a stick sort of a thing that you rub on your face, and acne were actually falling. And I was scaling up my head. What can be this? How can this happen? Logically. Is acne some sort of a thing sticking onto your face? No, it is not. But there are people who they are tender hearted people, they are simple people. If all of us, if today my car breaks down, I will automatically go to Google and YouTube and try and look for a fix before I take it to the mechanic. As a man, I can only talk in these terms. एंड आई विल ट्राई ऑल द DIY फिक्सेस. हो सकता है कहीं कुछ पेच लूज हो गया, हो सकता है कोई ऑयल कम हो गया, हो सकता है पानी रेडिएटर में खत्म हो गया, हो सकता है इसकी हवा खत्म हो गई हो, समथिंग लाइक दैट. सो वी ट्राई ऑल दिस तिगड़मबाजी टिल द टाइम थिंग्स गो बैड, एंड देन वी स्टे. नहीं नहीं यार, एक काम करते हैं, अभी भी किसी गूगल पे ही देखते हैं कि किस डॉक्टर के पास जाना है. Someone who is close by, someone who does not charge much fees, and someone who has reviews that हाँ ये मेरा तो 2 दिन में ठीक हो गया था. I don't have to go through the entire process. Something that will just give you something. The other day, I was overhearing at some doctor's place. I wouldn't even call that gentleman a doctor. So I had gone to a chemist. Chemists also have somebody sitting who can actually inject you those injections, right? So there were 2 people who had said, मेरे को बुखार है, so kindly give me something. Once he gave the pill, he says, मेरे को ना depression का भी टीका लगा दो. So apparently there has to be a टीका for depression. That's how that guy came up with that term कि depression का भी टीका लगा दो. So there are a lot of things at a ground level that are working, not only in India but all over the world. all over the world. It's there in America as well. I was speaking to someone, I think January, February. That's what she told me. She says, Harman, you have in Walmart, you have in these bigger stores, Tesco and all, people are having pamphlets. There are people who are standing at the gate. They are giving you pamphlets along with a QR code that will deliver HRT to your home. You don't need to even go anywhere. Dr. Arya, you've worked in US. You know how the system works there. So this is the condition of So whatever you were explaining, it's very important for us to accept that we are in a very safe place. Why? In India, because we have Ayurveda. And in this panel, we have somebody who has been associated with Ayurveda for a very long time. Dr. Chetna Kotwal, I welcome you. Dr. Chetna, Ayurveda speaks about imbalance long, long before disease starts to appear. How does that translate into modern life today? Have you seen people come for preventive care to you in your practice?
Thank you, Harmanji, for bringing me here. Uh, so I would like to start my topic with the thing is that the intent of Ayurveda is the first shloka of Ayurveda, that is Swasthasya Swasthya Rakshanam Vikar Prashanam Cha. The intent of Ayurveda is prevention. And we have bought this thing into a rat race with other medical systems that we have to bring Ayurveda ahead and other systems behind. That is not the intent of Ayurveda. The intent of Ayurveda is to collaborate with all the systems and bring something new which the modern man or modern woman can have. Okay. Now the second thing is which you asked about is the preventive thing. A lot of patients come to me, but they come when the symptom has already arrived.
Right.
The symptoms have already shown are showing, not before that. But we can find those things much before the symptoms arriving. Like for example, if we talk about perimenopause or menopause. So in Ayurveda, perimenopause and menopause, these things from a macro view is a life cycle rhythm of a women's life. It's a
Absolutely.
rhythm, it's a natural rhythm. So it's a transition period of a women from like we when we are young, we know that puberty arises and when we have menarche. So our mother tells us that this is the thing, you have to do this thing, you have these solutions, I am here for you and all. But when a woman comes into perimenopause or menopause, there is no one to tell her what she is going through. And in the in Ayurveda, we can find all these things much before she gathers all those symptoms. Like for example, if we if we take Nadi Pariksha, that is the pulse diagnosis, as a
Right.
if we create it as a biomarker tool, like a biomarker tool for identification of those symptoms, we can know that the particular women, all women are not facing the same symptoms in menopause. Every menopause is different. And in Ayurveda, if we see this, there are three kind of women, like Vata Prakriti, Pitta Prakriti, and Kapha Prakriti. And for example, uh, hello, yeah. So these are the three prakritis which we have, like the dominant prakritis which Ayurveda sees. Okay? So if before the onset of perimenopause symptoms, we can find these things through Nadi Pariksha, that which kind of symptoms she is going to have in future. But for example, if a woman has a Vata Prakriti, she is most probably to have symptoms which are more related to Vata, like anxiety issues, like osteoporosis, like she has an abrupt cessation of her menses or a heavy bleeding of menses. So prevention is much before. We can do prevention much before, but the problem is that people has taken Ayurveda so lightly so
Absolutely.
lightly.
Absolutely.
I call this as a Hajmola
Yes.
mindset.
Absolutely.
Okay, this is
Absolutely.
a Hajmola mindset of people that we just have to take a pill, any pill. We can take it two, we can take it three, we can take it four. Uh, I would like to tell you that, like Lotika ma'am was told, that I was also working in a research center before this. So I was in Rari, and I worked under the pharmacovigilance sector for some time, like 1 year. I worked there, and I've seen how people take Ayurveda. They take Ayurveda not as a prevention. They don't have any concept of that Ayurveda is a medicinal system. It has two bases, like the plant-based medicines and the metal-based medicines. They are taking medicines without any consultation and without any prior advice. And the blame is upon Ayurveda that it doesn't
Yes.
work. It doesn't work. It is a preventive medicine system, but we are not taking it in that
We are
way. We
not
are
taking
taking
it
it.
seriously. We are not taking it seriously. We are not taking it completely. सिर दुख रहा है, तेल लगा लो, ठीक है, वो चीज़ समझ आ रही है. आपके घुटनों में दर्द है, वहां तक भी आप कोई तेल लगा लो, वो भी सही हो जाएगा. बट
But also we
beyond that you need to go to allopathy, right, for the serious thing. So we've, in our minds, we have categorized rashes हैं, ठीक है, आप तेल लगा लो. स्किन ड्राई होगी, आप ये वाला तेल लगा लो. So Ayurveda has just become, as you said, Hajmola sort of a treatment कि खुद ब खुद थोड़े बहुत कर लो, 3-4 चूरन मिक्स करके खा लो, पेट आपका बिल्कुल साफ हो जाए. यहाँ तक का आयुर्वेदा का हम लोगों ने दर्जा दिया है. आई एम सॉरी, आई एम टेकिंग इट इन हिंदी, and I'm sorry if I'm ruffling a few feathers here, but this is exactly what we are doing. And we don't ignore prevention because it doesn't work. We ignore it because it doesn't feel urgent. Anything that feels urgent does not go to Ayurveda or homeopathy. Why? Because the mindset has been that Ayurveda and homeopathy are slow. ये तो यार ये test match की तरह है. I still remember, I don't know whether you have heard this or not, but Ayurveda and homeopathy are like test matches, and allopathy is the quick shot T20. Dum dum. One day T20.
But this is also a misconception.
Of course.
In Ayurveda or in allopathy, they say that we have the emergency medicines, but not in Ayurveda. There are no emergency medicines. Ayurveda does have emergency medicines as well. But the problem is that we don't have much marketing of it, a good marketing of it, a better marketing through certified doctors, and a better research set, which we can publish, we can show to people that this thing is working. Like if I may say that in Ayurveda we have a pill known as the Dhanvantari Golika. It's an emergency pill. If you have an emergency diarrhea, if you have like you're traveling and if you have something like emergent diarrhea or some problem here, you can take that pill and you can get instant relief of that problem. But the thing is that Ayurveda is projected in a way that it is slow, and it is take whatever you want to take. You can take ashwagandha along with that. You can take your kayam churn at night, and you can take in the morning. You can take the water as well.
You know,
Now,
you are 100% right here, 100% right here. So basically there is a very thin line, a very thin wheel between desi ilaj and Ayurveda. I'm sorry if I'm sounding a little rough here, but there's a very thin line between desi ilaj. So basically, people do not understand whether garam pani mein nimbu and haldi also construes as Ayurveda, or this is some folklore that has been going on. ये मम्मा ने करा था, उसके पहले उनकी मम्मा ने करा था, और शायद वहां से चला आ रहा है, हो जाओगे ठीक. हाँ, ये आयुर्वेदा वाले ने भी यही बताना है, ये करके तो देख लो. Another thing, there are two categories. Either Ayurveda is at Patanjali level, where you get everything off the counter. You don't need to go to a Vaid Sahib. Or it is luxury Ayurveda, which is being sold at 7,000 rupees a 30 ml serum. I'm sorry, I'm not
Like,
allowed to take. I'm not taking names here. I will be sued for that, right? But this is the discrepancy here. There's nothing in between there.
actually, the thing is that I want to say that the level of Patanjali or the level of forest essentials or what like the heavy good products and all that essential luxury products they are selling, that is not Ayurveda. Patanjali is not Ayurveda. They have they have
I'm glad
taken
you
some
said that.
they
I'm
have
glad you said
taken
that.
some of the drugs of Ayurveda, they mixed matched them and they created a Ayurveda is what is written in Charaka, what is written in Shadankar, what is written in Vishajya Kalpana, Dravya Gun. Each drug, their effect, their what they do to a person with this prakriti, what they do to a person with this prakriti. This is Ayurveda. This is not Ayurveda that you are giving ashwagandha to everyone as an adaptogen, as a stress relief. What if
Yeah,
we are giving this ashwagandha to a person who has Vata, has aggravated Vata? He will get palpitation. He will get anxiety issues. So Ayurveda is actually a
great.
customized. It's not
Great.
a one set all under
It
one
is a
umbrella. We can
personalized thing. It's a heavily
yes,
personalized thing. You cannot just generalize it that okay fine OTC आप ये खा लो. It is not like a दंत चूरन whatever
Danta.
that दंत कांति कि भाई ठीक है एवरी सबके ही दांत साफ हो जाएंगे, नहीं होंगे, सबका पेट
Yes,
साफ नहीं होगा इससे. That
yes,
brings me that brings me to something which I want to ask everyone now. Can modern medicine and traditional practices truly work together, or are they fundamentally different approaches? I want to start with Lotika ji. Lotika ji, do you think that there are two fundamental different columns, or they can at times merge?
Uh, I go with Dr. Chetna because the concept for this Ayurveda drug is I have worked in Ayush too, and from regulatory perspective, I would say that whatever the drugs of good houses like Dabur, Himalaya, they are available in the market. They are to be approved. First, formulation need to be approved by the authority of that state, or if it is of a new drug, then it is to be approved by the Central Drug Authority of Ayush. So there is a very, good stringent control over these drugs, whatever that are being manufactured by these companies. I mean, I have two. There are many companies in India, and they are under the ambit of these regulation, Ayush regulation, and they they have adopted this Schedule T is there in drug
Right.
regulatory system. So everything is made not like churn or everything the way people they have the
Construe
concept
it.
about
Yeah.
drugs, but they are made very meticulously under regulatory control, stringent actions, and even they are pre-tested when they come to market. So, for me, allopathy and Ayurveda drugs, Ayush, on the whole, from Unani, homeopathy, as well as allopathy, they can be integrated because this is for the patient betterment.
Right.
And if
Right.
doctor, prescribing doctor, I would say because I am not a physician, so if they think that if they both can be integrated and it will be a good effect on them, uh, keeping into consideration that there should be no drug-drug interaction or no two molecule interaction in the body, if
Right.
they are that much sure that in vivo that kind of drug interaction is not there, then they can prescribe the drug, nothing of that sort, because so many products, good products, Ayurveda products are available in the market, and I think more than us, international market, they are exporting a lot, and there is so much of
Absolutely.
regulatory control that has come over these products, and they are pre-tested, pre-qualified before they are sent to the market. So it's not. I'm not talking about these drugs, Ayush drugs. I said in my previous this thing also that allopathy and Ayush, they are all regulated through some agency, through some
Right.
regulatory framework. Other than that, these nutraceuticals, they are upcoming products. They are plant based, no doubt. They are not harmful. But if you have so many problems like perimenopause, you are having so much of bleeding and this osteoporosis, and you are going for those doses and those strengths. This will not bring any change into your body or into your overall well-being. So that should be looked into. And many of the drugs, they are not OTC drugs. They are to be prescribed, and it should be the duty. One doctor should be dutiful, and patient, I don't know. There must be some case we don't discuss these problems at home with our kids and our elders, but over the counter drugs, they can be they can be sometimes it can be
Difficult. Difficult. Yeah.
too difficult and harmful to that patient. So that should be avoided,
Right.
because I cannot. Regulatory framework is very stringent. It's not that way. If somebody is getting medicine through some counter, they are booked whenever the complaint is lodged, because there are so many outlets are there
Of
in
course,
India.
there are.
It's
Right.
difficult to maintain and to monitor and to to do. But whenever there's a complaint box, there QR codes are there. Whatever complaint is is really addressed by all the regulators in all over India. So I
Perfect.
think they can go. Ayush and allopathy, they can integrate, and it will be a very good platform for any patient, because at the end of the day, patient requires solace and some kind of relief from the whatever symptoms he is having
I
with
wanna,
his
I
own.
wanna, I wanna, I wanna bring in Dr. Hitesha. Dr. Hitesha, what's your perspective at this, Dr. Hitesha?
Yeah, when we talk of holistic healing, and see all the, I amalgamate all the practices as and when required. As Dr. Chitna said, we all have a predominant prakriti of Vat, Pitta and Kapha. To give a simple example, like supposing a person is Vat prakriti and you prescribe them milk or you prescribe them high doses of calcium. You know, we have a tendency कि for bone health आप दूध पियो, पर a Vat Prakriti person will have difficulty in tolerating good amount of milk or
Right.
some tablets. So that person is not going to continue with that treatment.
Right.
So I do a Prakriti questionnaire sort of thing whenever a woman comes to me to know the basic Prakriti of that woman so that I can give my advice accordingly. Similarly, a Vat person will not be able to digest high doses of protein. कि उसको बोलो कि तुम हर रोज कठोल पल्सेस खाओ कठोल खाओ वो उसको डाइजेस्ट ही नहीं होने वाला
नहीं
है
होगा, नहीं होगा.
yeah so we need to have the basic knowledge of the body as a whole. I'm sorry to say that allopathy often targets the organ, it doesn't target the body as a whole, while Ayurveda targets the body as a whole and homeopathy targets the mind, the psyche. So when we bring all these three together, it is going to produce good results. Having said that, it has to be done by the relevant practitioner only. Like
Absolutely.
I know
Absolutely.
that she requires this type of Ayurvedic treatment, but then I will send that person to a Ayurvedic practitioner who is a genuine Ayurvedic practitioner. I'm sorry to say, because these days most of them have started prescribing allopathic medicine. So, yeah, but still there are genuine practitioners in
Absolutely.
existent, and that should be done.
There's another trend that is happening. I want to bring in Dr. Arya's perspective to this. Dr. Arya, there's another perspective that is going on. You have AI assessing your health and giving you prescriptions now. Prescriptions I'm talking about. AI bots who has a predefined criteria of what to look for. After that, they will scramble some possibilities, permutations, and combinations and prescribe you that. And people are falling for that. Do you think we are moving into a danger zone now?
Uh, Well, I'm not really anti AI, but I see a lot of trend. See, people are, the problem is not the AI. Problem is the misinterpretation of their own symptoms. आप जो feed करोगे वही feedback you will get, right? AI is moving far in a very, very fast way. And there will be no wonder if in the next 5 years, a lot of practices, medical practices, are replaced by the AI. That is going on. The radiology, the pathology, a lot of things are moving, completely shifting onto AI. In China, they have moved, and in India, maybe another 5, 7 years it will take for them to take over. So we cannot completely disregard AI as a tool for searching. It gives us a good perspective, but at the same time, we cannot solely depend on AI, because
For
what
decision
we
making, yeah.
feeding to the AI might not be
Absolutely.
complete
Absolutely.
information. Yes.
Because what you are feeding to AI is your
Yeah.
understanding. So basically,
Yes, that's what
it
I'm
has
saying.
come
Like,
down to
are
your
you
understanding of how much you know about your body.
know about
Now,
it? Huh.
when I started working in this particular industry, I came across something very strange. There was an AI bot that was developed by a certain company where you had to put in your skin type. So that thing came to my attention, and I asked a couple of people, how, what's your skin type? So the first thing that they say is it's T zone. I've got T zone oily. But what about the other? Your face is not the only skin you have. How can you just how can you just
That
identify?
themselves confused also.
Yes,
If you ask me the same question, I don't know how to classify my skin, whether it is the normal type or the dry type, because some days it's dry, some days it's normal.
absolutely. So now when the AI asks you what is your skin type, what's your name, what's your email, what's your phone number, what's your Instagram ID, and what is your skin type, you will obviously say I got some oil here in the morning, and probably so it should
Yeah, so
be
you
T
might
zone
classify it as
because
a oily. You might
yeah,
classify it as a oily. So that's
yes,
what the thing is, that the information that we feed AI, so it's a robotic thing. So whatever you give, it will give you back that information. Similar, and just search the internet for similar kind of sources and then bring back the results. But the information that you might be feeding might not be correct.
and this is exactly what brings
Yeah.
me to again the same question: can allopathy and what we term as alternative healing, rather they should be termed, everything should be taken into one basket and termed as integrated healing? Do you agree with that?
I was just going to say that because I use the word integrative healing. So I have a very interesting story of my own self, if you give me two
Sure,
minutes.
sure, 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 sure.
When I began my medical practice, we were, young at that particular point of time as an oncologist, and I would be like, every cancer patient who would show up would definitely try something of Ayurveda, and they would delay the treatment, or they would be visiting a lot of homeopathic doctors as well. And the moment they used to tell me all of that, that we are doing this and that also, I would give them a nice bashing. Why are you doing all this? Do you know you are delaying the process and your disease is going to progress many folds and all of that? And gradually, as I've moved in my practice over the last 20 years, I've seen not only for cancer treatments, but also for this hormonal health, myself included. If if you are making informed choices, they can work wonders. In fact, Western medicine is moving in a big way towards Ayurveda.
Yes.
Yeah. So Abhi just Chetna ji, she just mentioned about ashwagandha. So exactly, the point is we need to have the right practitioner and a coordinated system of working between the doctors. It's not one size fits all, but then everything has its own role to play. For Ayurveda, some of the things, like in my cancer practice, now I tell patients to visit an Ayurvedic doctor to manage the side effects of chemotherapy.
Great.
So yeah, so it really helps for perimenopausal women like myself. I had a lot of period issues, and I got myself treated via homeopathy. So everything cannot, every one particular medicine cannot treat every single thing, and it might not be suited to your body type, your prakriti, as you are saying. So
Yeah.
we need to bring everything under one umbrella
The whole
and
perspective. The
have
whole
a system
perspective.
of
Yes.
coordination amongst the doctors, understand each other. The doctors should be able to, you know, get on a call or maybe something and discuss the patient history and discuss with each other what all is required in that particular patient, and it should be treated in an integrative and a holistic manner.
What you're trying to describe here, that's got one word to it. One word encapsulates everything. That's called as hope.
Hope.
So when somebody comes to you, they come with a lot of hope, and somewhere down the line, the 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 encapsulation of hope becomes bigger. They have bigger hopes. They have hopes to be healed faster, so they try everything. So they will try allopathy, they will try homeopathy, they will try ayurveda, they will try desi nuske, they will even try babaji's. I'm telling you.
I'm not, yeah, yeah. So what I'm against here is, what I want to share here is trying and failing are no-nos.
Yeah.
Rather, I mean, like even the government has started integrating Ayush centers
Yes.
along with our
Yes.
the main allopathic centers. But still, there is a lot of disintegration between the doctors. उनको लगता है मैं उससे क्यों बात करूंगी या मैं उससे क्यों पूछूंगी. अगर हम if we move on together and find out what is the best fit for the patient, I think that would
Great.
be really good.
Great. Brilliant, brilliant. And that's exactly what we are trying to build as Global Menopause Collective, is that we are trying to build an integrative sort of a system which looks at somebody's problems from a 360-degree perspective. So we have, certain so many experts like yourself, Ayurveda, homeopathy, psychotherapy, from regulatory authorities, energy healing as one of the modalities that we have. Various energy healing, not just one. We've got somebody who specializes in medical astrology. Very frankly, till the time I met him, I had no clue if something of that sort of happens. But then he convinced me that yes, there are certain, you can be predisposed because of certain star plays, and I'm pretty convinced now. This is exactly what we're trying to build in Global Menopause Collective, the integrated approach, looking at 360 degrees view. So somebody asks a question, there are more than 30 people who will come and answer that question from their own perspectives, from movement therapy, from pelvic floor, from yoga, from meditation, from Ayurveda perspective. And till the time, it's not to overwhelm that person, but it is to give him the complete picture that yes, your problem does not have just one solution, but it's got an entire ambit of it. What's your perspective, Dr. Purvi, about this? Just,
Integrative
just
approach of treatment
right, right.
because
Yeah, please repeat yourself. You
yeah,
were
okay,
muted
yeah.
earlier.
So, yeah, I do agree. Yeah, I do agree that all the patient need integrative approach of treatment because not sometimes when we give also specific medicine, it couldn't work. Why? Because that patient might require some more kind of counseling or
Absolutely.
some meditation or some mindfulness teaching. So, and also above all, lifestyle changes is very important to understand with everyone. Because I have listened a podcast of Miss Nisa Mesponi, scientist who is researching on female brain, and she showed that what kind of eating habit does hazards to our brain, and especially in a postmenopausal age woman. So she also tell us that if we want to active our brain till the death without any Alzheimer, without any ADHD or physical symptoms like breast cancer or hypertension or thyroid, whatever, then we need to approach holistically. Not only one kind of medicine or not only just doing workout or not only changing eating habit. It should be holistic. And
Perfect.
so holistic means we need to take help of each and everything,
All the
those things which
perspectives.
will help us to bring that health.
All the perspectives.
Yeah.
What's your thought at it,
Yeah, all
Dr.
the
Shrestha?
perspective.
What's your thought at that, Dr. Shrestha?
So, Harmanjit so I have been trained at institutes like BHU and Safdarjung Hospital, which have, Ayush department and which have
Right.
homeopathy and Siddha department. So, as a resident, I've always been of the opinion that, there should be an integrative thing. But as Latika ji, she correctly pointed out that we should be knowing the drug interactions before, like we are prescribing medicines. So yeah, that is one thing. Because at the end, we are treating one human body. I mean, human physiology, by the end of the day,
Right.
it's the same, right?
Right.
The biochemistry, the physiology, the processes occurring. So it's all the same. But yes, as Dr. Arya, she correctly pointed out that we as doctors from all, specialities and all forms of medicines, we need to come together and then devise a plan for the holistic, treatment and an integrative approach.
Wonderful, wonderful. What a beautiful conversation that we've created today. You know, we brought in all perspectives, all sorts of various things. So perhaps the future of health is not in choosing sides, but choosing balance. And as we close today's conversation, I want to leave you with one thought. Your body has never been against you, it has always been communicating with you. Every symptom is a sentence, every imbalance is a message. And the question is, will you wait for the message to become louder or will you choose to listen earlier? As all our experts mentioned, it is wise to keep listening to your body as and when, as and how it speaks. Preventive care is not an extra step, it is the foundation. Medicines are not the enemy. Misuse and misunderstanding is. And health is not something you fix one day, jab hoga tab dekhenge. It is something you build every day. So as you leave today, don't just carry information, carry awareness. And more importantly, carry responsibility, because the future of your health is not in a prescription, it is in your daily choices. So thank you all my experts, thank you all the viewers who have joined in. Thank you so much for a brilliant perspective here. And I can't thank you enough, all the people who've joined, all the experts who have joined and given us a beautiful session today. So I'll just unmute everybody, and yeah, it was a very hearty conversation.
Yeah, indeed.
Perfect. So thank you so much, everyone. I really appreciate your understanding, the time you took, and all the information you gave. Thank you so much, everyone.
We will have to wait for some time because it's not yet
Thank
uploaded.
you.
Once we log out, then the uploading will
So
be
we are
incomplete.
still live, Dr. Arya. I'll just stop and then
Okay.
we can. So bye bye. Take care.
Okay.
Thank you so much.
Thank you.
Thank you.